Hello, my name is Frank Gannon. I'm the director in UIMR Berghofer Medical Research Institute. I want to talk to you in the context of the Bridge program about the topic of wealth from medical research. Now, if you reflect on the sources of wealth, those components that add up to the GDP of a country or a region, you'll find that there are three general areas. One is what nature gave us, like resources. The second is what we have built, like agriculture, infrastructure, tourism. And the third one is what our intelligence gives us, the knowledge economy, the innovation economy. Australia is great for number one and number two, but in fact, number three is lagging behind. We are not mining our intelligence in the same way as we mine the earth. And although this is disappointing, coming into the topic, we should put it in a context of some good components that I won't stress because they're well known elsewhere. The first is that there's been a growth in ASX-linked companies, particularly in the area of biotechnology, life sciences and related topics. There's a growth in market capitalization, there's a growth of private companies, and there's a growth in the number of employees. All investment. It's also good news that Australia produces 3% of the world literature and, as we often say, punches above its weight. So we have a great reputation worldwide for knowledge generation. The NHMRC spends approximately $1 billion a year on health research. The ARC contributes to some underpinning aspects, and the Medical Research Future Fund is adding annually to the amount that it is investing, with the figures eventually going to match those of the NHMRC aspects. However, the health research expenditure by Australia is not at the OECD average. In fact, it's only about at 2/3 of this. So health research within the health budget is not getting sufficient money. And I think we know that research is not sufficiently connected to end users or developers, and I'll show a slide related to that in a minute. There are relatively fewer numbers of PhDs in industry in Australia than in other advanced countries. And perversely, it would appear as if there are men. So let's look at this slide here, which outlines the two factors, the innovation input from the country and the innovation output from the country. And if you look down the slide, you'll see that Australia is ranked 11th in terms of the input, the amount of potential material that's available for innovation. But if you look at the output, in other words, that which gets converted, we rank a lingering 46th out of this large range of advanced countries. Now, those of you who are listening carefully may have detected that I'm not Australian. In fact, I'm Irish. And that's why I point to number 12 on this list, Ireland, in terms of input, and it's number 11 in terms of output. In other words, there's a very good linkage between what the country is generating and how it's impacting on innovation. That is a major problem for Australia and a major illustration of the extent of the problem. Another illustration of the difficulties in Australia is this indication of the collaboration on innovation between higher education and firm size. Now, the dates are not up to date, but the figures won't have changed significantly. If you look on this curve here, you'll see that over here at the very end you find Australia. In other words, this is not a high percentage of collaboration. And there's a subset in this information. The SMEs are in the lighter grey colour and large firms are in the dark colour. And there you'll see that Australia, unusually, except for Mexico, is in fact more dealing with small firms than large firms. Or put another way, there are not enough large companies in Australia with whom the Australian can interact. If you look along the line, you see that that is out of line with everybody else. So we need to grow or attract more large companies and collaboration. This slide here shows the standard pathway for a research scientist in an institute or a university. You can start at the science laboratory, making publications, which then allow it to get more funding, and so it goes to the circle of funding, laboratory, publications. And that is one which is a closed loop that is. The words that are used frequently is that we move from the bench to the bedside. And that's a very comforting image, and it makes people feel that we are doing the right thing, but it is a gross simplification. If we look at what really is happening, we have to go from the bench through pharmaceutical or biotechnology companies, through clinical trials, eventually to have an impact on the clinic. And in this talk, I'm going to emphasize only the activities that can give rise to a product in the clinic. There's a whole important area of prevention that I will not address, but I don't think it fits into today's conversation. So we've got to understand how things work to change them. And I think there are some structural problems that work against our understanding. The funding system rewards research publications because, to a large extent, the peer review system is populated by researchers who really appreciate great research publications and strive to have those themselves. Funding to move discoveries from the laboratory is hard to find. There's some money available for that at the very early stage, but it's a small percentage of the funding that goes into research itself. Funding for clinical trials, which is often a step up in the cost, is hard to find. And therefore, the motivation to move things from the laboratory publication funding, the LPF cycle, is very low because you get rewarded for doing what is currently the situation, excellent. What we need, therefore, is to translate more, but within that box we also need to ensure that we retain balance. If we shift too far towards translation and application, we will definitely lose the advantage we have in Australia of being excellent research generators. A balance need works in different ways. First of all, between what society needs, top-down, and investigator-driven research. There has to be a match between those two. There has to be a balance between those two, such that it's not just using the investigator as a contract researcher, doing research in areas that they may not be perfectly motivated to perform. There has to be a balance between knowledge generation . And here we come to another conundrum. It is too easy for us in research institutes and universities to talk about translation, to say that we are carrying out translation, when very often we mean translatable research, which is a slightly different matter. The steps in translation are typically characterized as being T1, T2, T3, T4, with that starting from the passage into the first patient, or the first time a doctor shakes a patient's hand in a clinical trial, and the period before that is called preclinical, or T0, and quite frankly it covers too many steps. That means that we can hide and justify our existence behind the confusion . Two is disease-oriented research that will generate knowledge that has the potential to be used in some disease setting. and also to move. The next stage is D3, and here is the first time where we identify a target that could give a practical outcome if it is modified in some way. And there are examples there of a protein that could be the cause of a disease, but there are multiple other variations on that. And D4 then is the step where we develop something which will allow us to change that target, switch it on, switch it off, modify it. And then with that product in mind and ready, we're able to move to real translation. If you can consider a basic research institute, and in an extreme characterization, that could be a university or perhaps a university of the past. There the profile was D1, basic pure research, some disease-oriented, less coming from that, and no real progress beyond that point. And looking at the profile of publications, that may be the Australian overall situation. Exaggerated, perhaps. If you looked at a clinical research institute in a hospital or related to a hospital, you'd expect that the curve would be like this, with most of the work ongoing there being in the translation phase itself, with some of it leading to it, but predominantly in the translation phase. Obviously, I'd be interested in what happens in a medical research institute, and this is what happens in ours. D1, we've got very little genuine, pure, basic research. Almost 50% of our research work is in the area of discovery related to disease, and 47% tracks beyond that, from identifying a target, identifying a way to modify it, then moving into clinical trials themselves and beyond that. That's what we do, and in each laboratory you'll find a combination of D2 and maybe D3, D4, because every laboratory usually has got 2 or 3 projects. So just a word about QIMR Berghoff Medical Research Institute, and you can see it there on the slide. It's a world-leading medical institute, of course we have to say that. It's only fully integrated biomedical research and development centre. It's one of the only ones of that in Australia. It's been going for a long time, since 1945, and it's dedicated to translating discoveries into treatments, diagnostics and prevention strategies, which is appropriate for a medical research institute. Some information about us to back up what I'm saying there. We publish over 800 publications annually, and they garner about 30,000 citations in the 5-year rolling analysis by Thomson ISI. That's higher than almost all, if not all, of the institutes in Australia. 50% of our research, as I indicated before, is disease-oriented, and 50% is on the path to translation up to and including clinical trials. Interestingly, we were ranked 7th in the world based on the percentage of our publications, which are extensive, that are cited in other people's patents. That shows exactly the point, that we're doing great research that is underpinning useful outcomes, but we are not ranked 7th in the world for our patents by any manner or means. 70% of our researchers have active collaborations with clinicians, which again is appropriate, and currently we're directly involved in leading 20 clinical trials in this year. So therefore we've covered the whole spectrum from A to Z, or Z depending on your background. Significant discovery research, working on diseases of high impact, world-class facilities. We've got a TGA certified manufacturing unit for cellular therapies, which is called QGen Cellular Therapies. We have a wholly owned QPharm clinical trials company, and we are co-located with a major tertiary hospital, the RBWH. So you can see A to Z and are fully integrated. And there we are on the grounds with the hospital all around us. UQ and QUT are also on the ground, so it really is a hub in the Hurston region of Brisbane. We're also part of a Brisbane-wide Advanced Health Research and Translation Centre, which brings together hospitals, research institutes, medical research institutes, universities, primary health cares, Queensland Health, under the banner of Brisbane Diamantina Health Park. So let's get back to the pathway from the lab to the clinic. Our philosophy is summarized as following. We believe that you have to go from bench to business to bedside, or more pithily, B to B to B. That's the basis of our structure and the way that we are working. An example would be in the area of vaccine and cell therapy, where research in cancer or in infectious diseases gives rise to a discovery, an antigen that can be used in preclinical models, which then moves into clinical trials, which then moves into manufacturing within our QGen facility, and eventually moves into clinical trials with Q-Pharma or elsewhere. So we go from the start all the way through, and each of those steps require different attitudes, different cultures, different skills. But what are we doing to get more from research? We're doing a lot of it, but we could do more. And here I have a reference to an article that came out this year in Australian Biotechnology. And in essence, what we were doing are looking at the 4 steps of disclosure, proof of concept, pre-incubation of ideas, and finally, commercialization. So let's start with disclosure. Far too often, researchers in their laboratories have a wonderful idea in their laboratory meeting. They move on to do some experiments related to it, but sometimes they don't get to continue that, and sometimes it gets lost in other priorities. Finish a different paper, get a grant proposal in and get the preliminary data ready for that. So in that way, ideas that come from the expertise of the researchers can and is lost. So we've decided to try to encourage researchers to identify ideas of potential, really early stage ideas of potential commercial relevance. And for this we offer what I call a good meal for a good idea. In other words, it's not a lot of money, but it's to encourage people to set it down, record it, and they get a small reward for that, which may buy a good meal for their team. In addition, annually we have a census where we ask the researchers to identify the projects which they think are at the stage of D3 or D4. In other words, a potential target that could be useful or a potential intervention that could be useful acting on that target. And this provides our business development office with information on the disclosures, on the areas where people think they're moving towards a disclosure, and they also have a portfolio approach where everybody is monitored and handled by the members of the business development office in a very interactive manner. That way we try to identify as much as possible that's going on within the institute. This is like the geography, the geophysics, the geochemistry analysis that ultimately gives rise To take the next step, we have a proof of concept fund. Working with the business development unit or office, the researchers define a key experiment that will move the idea to a point of value inflection. This is where a crucial illustration of the expectations of the hypothesis is demonstrated. And to do that, we give varying levels of support, which is defined by what's needed to do that one key killer experiment. That could be have a research assistant working for a while, it could be to buy a very expensive reagent or anything else. And we're guided in our choices of these proof of concept projects by an internal committee that carries with it a lot of experience in related to commercialization, but also externally. Then you move ultimately, occasionally, to commercial options. And when it provides a commercial opportunity, the choices are obvious. You can license, you can enter a research agreement with a company, or you can get funds for a startup. If I can just mention or go back to B, the research agreement with the company, this is a way that we find very favourable to really advance the research with the financial support and the intellectual and practical input from a company. And that very often has hastened progress very rapidly. I think that is something to bear in mind rather than simply licensing to a third party at arm's length. Unfortunately, usually options A and B, the license or the research agreement, will mean that the IP will eventually leave Australia because the number of companies in Australia that are large enough, as I mentioned earlier enough, to bring a complex molecule to the market through all of the regulatory and clinical trial phases are very few and far between. The startup option is sometimes even a key performance indicator, a KPI for heads of organizations. And typically that can drive behavior in a way that may not be exactly the best outcome. Startup options from a place like QMR Berghofer is typically high risk and early stage. It's freshly out of the laboratory's considerations. The level of investment that is typically available is of the order of $2 million. And it seems to happen that the value of the ownership of the IP is always reduced to about 40 or 50%. So step one is you get some money and you give away half of the asset. If things work out, the strategy in the past was to sell on to a larger and usually non-Australian company. Now there's a change in that recently with more funds being available to organizations such as the Medical Research Commercialization Fund or Brandon Capital, and that's been a good move. We have to see how that impacts. What's needed is a sustainable commercialization solution. If we grow to 10 million size company and exit, that's the end of the story. The trend in Australia seems to be to support single product IP or investigator companies, and very often they don't have the multiple dimensions in order to become a consolidated company. Therefore, we grow, sell, and then a new idea has to be found. This is what I've labeled the Sisyphus model. You may remember the story of Sisyphus, who had a big stone. He had to push it up a large hill, got it to the top, and when he got to the top, it rolled down again. And poor Sisyphus had to start again and push it up to the top, and it rolled down again. And eventually you may run out of stones ideas to be pushed. So we need to do something that avoids that particular construct. We need to have a more ambitious plan with a pipeline of products that are retained such that they can reach a scale level. The next step sometimes is skipped over. It just goes straight from the identification, proof of concept, and then it's licensed or pushed into a startup company, which may be fragile. What we think is that it's possible to go further. Sometimes it's possible to move forward with discovery grants or the related titles from the NHMRC or the ARC or the state grants, with Queensland having advanced Queensland grants for this sort of area. And sometimes it's possible to get investment from external sources, as I mentioned. But some are best retained for further round of de-risking prospect. It was for this reason that we established what we call the seed box. Seed box comes from scientific exploitation and entrepreneurial development, and seed box is in fact both of those things, exploitation of the science and entrepreneurial development. In the seed box, the project is retained in the institute, but moved partially or completely to a more biotech environment. And this is where we have to recognize that the culture of research is not the same in a discovery laboratory as it is in a development or biotech environment. The goals of the researcher are not the same as the goals of the company or the pre-company. And by having different individuals carrying out the work, keeping their eyes focused firmly on the pathway to a product, it is better, we think, than leaving it in a laboratory where the demands of a new paper, new information required for a grant proposal, and the standard way of working in a research would dominate. But we keep it adjacent to the founding laboratory. The discovery group is still very much involved. And that's important because greenfield sites, which are very often also the first location for startup companies, they wouldn't have adjacent to them specialized assays, specialized equipment, the expertise and knowledge that resides in the group that discovered it and their colleagues. So that combination of retention within the institute, slight separation in terms of the research delivery, is something which we believe is an exciting, important, and hopefully beneficial experiment. Our plan is to maintain those pre-companies that are put in the seed box for a maximum of 2 years. We get advice on this from external experts as well in terms of what we that. Now, going through all of these steps, you'll see that there are quite a number of valleys of death. You hear of the valley of death frequently, but really it's the plural. First of all, there's the gap to fund confirmatory research. Many people perform research which is good, certainly quality level for research publication, certainly confirmation in that environment. But in order to focus on the confirmation of a particular product type, different sort of experiments may be required in order to get there. And that's hard once the publication is out there pointing out that this is a wonderful target. There's the gap to fund the first-in-man trials when you get to that stage. First-in-man trials typically are about $1 million, very complex, very structured, and they are hard. It's hard to get funds for that. Again, efforts are being made to expand the funding for clinical trials, but they are not matching the needs, and it becomes a block on what's happening. I should have said that the gap between discovery and development is also a major problem, because again, it's not of the research type that readily gets funding, although there are some funds available from the standard sources. The gap between development and the product are even more hard to get, because you've shown that your great idea is right, you've shown what it could do, you've got a nominal product, but these always need to be improved upon. There are always variations on the chemistry that can make a better product, etc. And getting that funding is very hard. And then there's the gap between a startup which has got all of the ambition and even a potential product, and growing it to a sizable company. That is hard to maintain, and that's another gap which is frequently discussed. And there's the gap, I would say, between retaining the commercial benefits in Australia against the ease of licensing abroad, or going abroad for funding, because that's what we usually hear. We had what the bridges need, rather than just being defined, is of course money, 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 money. It also requires a lot of person-to-person interaction. You need to have proximity, you need to have opportunities that those with the ideas talk to those who can develop them, who can talk to those who can fund them and develop them further, and those who can make them into a company. That requires not just person-to-person, but institute to companies. We have to get out there and tell the companies what we are doing, why we are a relevant partner, and measuring our success in that way as well as by publications. There has to be an understanding of the cultural barriers. Frequently this is overlooked and it's presumed that all research is the same and therefore everything can work in the same way. The motivations for individuals can vary a lot. The motivation for somebody to have a lot of input into the training of the next generation of researchers or scientists or practitioners in general is different than one which is totally focused on research. The first person may engage in some research, but not completely. The second person is fully committed to research. And within that research portfolio that they're involved in, they may just like to do discovery. They may in fact only want to do basic research. It may only be the thing that they only feel correct is about. They may feel not comfortable with business and money generation. There's also a bridge needed between management and the guidance that's needed to bring along internally the combination of discovery and exploitation. That needs an understanding of the needs of the research community and also how to get the value out of it. There are bridges needed with early and frequent contacts. This is not a game that can be played in a corner and with a sense of understanding of your own area. You have to get out and let other people know what you're doing. So there are some conclusions. There are a wealth of opportunities that are not adequately mined in research laboratories. Going back to the geophysicist, the geochemist, the analyst of the ground, knowing where there is some resource to be mined. We do that in the research labs with discovery, and then we abandon it. Unfortunately, although minerals can stay in the ground for millennia, new ideas don't. We have to move with them rapidly. We have to create a culture in the research labs that's open to commercialization. Repeating in our institute the mantra of B to B to B is beginning to sink in and make sense around the place. It means that yes, we do want to have an impact on the patient, but the road to that is through a business stage. The LPF cycle, the laboratory publication funding cycle, has to be challenged. It is being challenged on all sides, and people who are fixed in that particular cycle and perhaps very successful within it have to recognize that there's more to it, that society demands more from the funding that's giving, and that there must be a return on investment. Translation is a word that needs to be defined and understood sharply, not as a general way that covers a multitude of steps, many of which are many miles from translation, and in fact are not too concerned about getting there. We have to work on a long-term rather than short-term relationships. We have to build up connections within industry, with funders, with venture sources, such that they understand and trust what we're doing. The Sisyphus model has to be changed. We cannot keep having a great idea, having a modest outcome, and then trying to do it again. There are a number of bridges that have to be built, and I outlined all of those, and you can see that it's a complex requirement. And finally, I think we believe in the pipeline model that we have developed. We think that that will in fact make a change. It integrates a lot of our thinking in this area, and it will take some time before we can prove it, but we feel that it is the right road for us to take. We'll be interested to see how the seed box works. We'll be interested to see how we manage the seed box in terms of its content, the degree of patience we have we're at a we're at a stage where I think